Start the next section, which is Mr. Inamura Takuma, who is speaking from Asia, from Japan. And he represents the Healthcare Industries Division, Commerce and Service Industry Policy Group, Ministry of Economy, Trade and Industry of Japan. So he is unable to be with us today. It's obviously very, very far ahead in terms of the time difference. So what he has done very kindly is to record a video for us, which we're going to show now, and be about 10 minutes. So thank you very much to Inamura Takuma, who's the Director of the Healthcare Industries Division. So we shall start.
Good evening. My name is Inamura Takuma, Director of Healthcare Industry Division at Ministry of Economy, Trade and Industry, METI, Japan. Unfortunately, I cannot join the live discussion due to the time difference, but I'm very happy to join this event with this distinguished expert on longevity. I will make a brief presentation on longevity and COVID-19 in Japan. Let me start with a background for Japan's discussion on longevity. Japan is already a super-aged and decreasing population society ahead of other countries. Our population will decrease to less than 100 million, and our elderly rate will come up to around 40%. Japan realized national pension in 1961, started universal health insurance in 1965, and introduced universal long-term care insurance in 2000. Such effort led to a big outcome. Average life expectancy of Japanese male is 81 years old, and female is 87, which is the highest among the world. We have more than 70,000 centenarians. But I don't want to emphasize the number on life expectancy. Rather, I emphasize the importance of healthy life expectancy. We should realize long, healthy life expectancy and shorten the gap between life expectancy and healthy life expectancy. Why do we need healthy life expectancy? One reason is for
We seem to have a glitch. Should we try and restart the video? Seems to have stopped. If we can just pick it up where it last left off. Yeah. Excellent, thank you.
But I don't want to emphasize the number on life expectancy. Rather, I emphasize the importance of healthy life expectancy. We should realize long, healthy life expectancy and shorten the gap between life expectancy and healthy life expectancy. Why do we need healthy life expectancy? One reason is for a sustainable economy. 55% of Japan government expenditure is social security expenses. Please see the upper diagram. While 2.1 working population support one elderly in current Japan, in 2040, 1.5 working population has to support one elderly. It doesn't look sustainable. If Japanese elderly are healthy, active, and can work until 75, please see the lower diagram. 3.3 working people, a double number of previous one, will support one elderly in 2040, which seems more sustainable than the previous figure. Some might misunderstand that Japanese government is trying to force elderly to work until 75. No, we just want to make a society where elderly can continue working, increase income, participate society, and contribute to the society. As a matter of fact, Japanese elderly become younger and healthier in bodily function by 10 years in last 20 years, which I believe make realistic the above-mentioned idea of the working elderly. Even in the last 10 years, when the Japanese population is declining, working population is increasing thanks to the rise of employment rate of healthy elderly and female. The working elderly has increased by 3 million. Since Japan is facing super-aged society ahead of other countries will face same situation following Japan. Aging is not Japanese unique issue, but global common issue. Therefore, we believe that Japan can be a model for global healthy longevity. Now, let's see new issues under COVID-19. Let's see the impact on Japanese elderly. A research by a professor of Tsukuba University showed a plummet in the activity of elderly during COVID-19. 81% of the respondents reported the decrease in the frequency of going outdoors. Please take note that the situation of COVID-19 in Japan is not so bad as in the United States and Europe. The daily new infection is around 1,000 people out of 127 million population. Still, the fear of infection keeps the elderly at home. They feel stressful because of losing chance to meet their friend and to end their life. Not only the elderly, but also on working generation, COVID-19 caused health issues. Several researches show the increase in such diseases as mental illness and stiff shoulders among employees who switched to teleworking. Seeing what happened during COVID-19 pandemic, I think we just faced issues which were previously mentioned but not adequately addressed. Keeping one's health was, of course, important regardless of COVID-19, but we truly realized its importance after seeing the vulnerability of people with pre-existing illness against COVID-19. In other words, I think COVID-19 requires accelerated response to the existing healthcare issues. Let me explain some of METI's approach to develop healthcare industries. Number one, health and productivity management. Health and productivity management is an approach that considers health management of employee from a corporate management perspective. METI started the Health and Productivity Management Certificate in 2014 to encourage corporate health investment and to create demand for healthcare product and service. The number of organizations certified in METI's program has rapidly increased in 6 years. Currently, 1/4 of listed companies in Tokyo Stock Exchange are engaged in health and productivity management. After 2021, Japanese people can obtain their own personal health record, such as health check apps, through a portal website for National Identification Number Card. The rules on security, privacy, and data portability for authorizing access to the data are under discussion. Finally, regulatory reform is essential for creating the ecosystem for healthcare innovation. Several deregulation measures have been decided, including the removal of restriction on telemedicine during the COVID-19 pandemic. This is a brief explanation of what Japanese government thinks and does. I look forward to learning from the experience of other governments and experts. Thank you for your listening.
Wonderful. What an incredibly comprehensive overview. And of course, Japan, you know, as the oldest country in the world, so to speak, in terms of its demographic and the change that they've seen, it's quite interesting how they've responded so incredibly to the COVID experience as well. But over to His Excellency Dr. Amiri, who will give us a more detailed view on the Middle Eastern situation from his perspective, the United Arab Emirates perspective. Thank you so much. Over to you.
Thank you, Tina. Once again, welcome to everyone, and allow me to share with you a short presentation. I'm quite sure the presentation is clear to everyone, Tina?
Yes, it is. Perfect.
Once again, I would love to share with you a sort of reflection of legacy from the COVID-19 and healthy longevity, which was experienced in United Arab Emirates. My colleagues from Japan were saying that you need strong policies, you need strong facilities to deal with, but I can say before that you need strong leaders to have a vision to support your healthcare system and to support your main entire, I can say, country to, in fact, to enable you in having the successful policies, legislations, implementation of technologies that allows you for the success in your system and in your policy. And therefore, here comes what our leaders believes, that human being, their ideas, innovations, dreams, and connections are the capital of the future. Wherever they go, tomorrow will for sure good things happen to the place which they be there, and they share with the government or with different sectors with their ideas and with innovations. And this is the statement of His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President, Prime Minister, ruler of Dubai. And here came the importance of investment on the main capital of the country, the citizens, the development of the, I can say, the country by putting our investment on the citizens, on the human being. And therefore, this is a statement of His Highness Sheikh Mohammed bin Zayed Al Nahyan, the Crown Prince of Abu Dhabi. This, in fact, for sure will take us in supporting our healthcare services. And this led to the swift rise of the healthcare sector in UAE. And there were a number of pillars that led this rise. On the left side, I can share with you some of those pillars are like the vision of the government to have a class healthcare system, the best class of healthcare system, the growing and aging population. Today we are talking about the longevity, and here the aging population is sort of putting a demand and a pressure on the healthcare services, increased burden of non-communicable diseases, and how we will be able to reduce the prevalence of those non-communicable diseases such as diabetes, hypertension, and the rest of it. Greater expectation of the community. The more, the higher educated people you have in your country, the bigger or the higher expectation of them will be for the healthcare services, expanding medical tourism, and then the international healthcare services, which they are having the base in our country. And this led that the healthcare investment to rise up from 56 billion UAE dirhams in 2019, which is forecasted to reach 89 by 2024. In fact, we tried to invest on a certain number of the national agenda to minimize different type of non-communicable diseases, which supports the longevity in UAE. And this is a part, I'm happy to share with you, a part of the national agenda of UAE, that how we will be able to minimize the prevalence of the obesity among the children, minimizing the number of the smoking people among male, female, and also the minimizing the number of deaths from the cancer per 100,000 population, and minimizing the number of the deaths from the cardiovascular disease per 100 million population. And on the top of it, which is being marked on red color, the average of healthy life expectancy. This was implemented since 2014, and now we are trying to reach the higher number, which we reached 66.7 for the year 2019. But the government had emphasized on the national agenda and has been emphasized on minimizing the cardiovascular and the related to the cardiovascular disease by implementing the healthy lifestyle to make sure that we will be able to minimize the prevalence of such non-communicable diseases and even the communicable diseases, and to raise the public awareness and to implement the healthy lifestyle with the total population at the entire country, and mainly with the youth, with the young generation. But this needs to this will not support you unless if you have the proper implementation of different type of policies, the policies which controls, like the policy which controls the communicable diseases, the policy which supports the intellectual property in the field of the healthcare, the policy for the promotion of the mental health. And mental health now it's being provided at each single health center and the clinics and the hospitals all over the country, and also the policy for proper and 100% immunization of the inhabitants of United Arab Emirates. And those policies are being updated year by year. And this slide will show you the example of how we will be able, since 2017 until this year, for last 4 years, to update almost 36 number of different laws, regulations, and the policies which it supports the healthcare sector and the healthcare indicators in United Arab Emirates. And this led to a success in rising the life expectancy at birth up to 79.8 in 2018, and the healthy life expectancy at birth, in fact, to 66.7. This is a good evidence and an example that the average of life expectancy is being increasing since 2000 until 2018. This is the report, but we have also the reports until today. But also to minimize the cases of death per 100,000 population. If you will look into the left side at the bottom, the death from the communicable diseases, it was 36 in 2000, the prevalent, 36 per 100,000 population in 2014, and now we are only 13.7. Death from the injuries, it was 32, now 11.7, and death from NCDs, non-communicable diseases, it was 547, and now we are almost one quarter of it, which is 106. Let me share with you some other indicators like the smoking, the prevalence of the smoking in our country, where 11% of the total population in 2010, and we are just by end of 2018, we reached to 9%. And we were able also to minimize the percentage of the obese people from 37% to 28% in 2018. And also the diabetes, which is one of the leading factor for cardiovascular disease, from 19% to only 12%. But the effort is being taken to go further and minimize more. For sure, I'm quite sure that the COVID-19 pandemic came as a shock to different governments, to healthcare system, and also affected the economics worldwide. And for the first time at the history that the health crisis shut down the entire global economy, and it was so painful, and also affected the healthcare services. And really, we were able to protect our community and to provide them with different sort of measures, those measures that allowed the people to be away from the hospitals and the clinics, and to provide them with the healthcare services while they're at home or they are at offices. And this is the legislation which allows us for implementation of this distance treatment programs, telemedicine, and also this was for the community protection. And despite that, there are many. Those are only, some of the examples, 8 examples that I'm trying to share it with you, how we were able to also monitor the supply chain to provide all the people, especially the patients with the chronic disease, with their medications without any complications that they can face while they didn't have an access during the lockdown to go to the hospitals. All the medications used to reach to their door to door to their house, and even the visits of the physicians and the nurses to their house, and to provide them with the needed healthcare services. The implementation of new innovations in R&D by using the stem cells, the plasma of the donors, and the new technologies, which this was a part of it, that we started to do the genome sequencing, despite the usage of the stem cells for treatment of the COVID-19 positive patients, the using of the plasma from the recovered patients, and also the implementation of clinical trial phase 3 for inactivated SARS-CoV-19 virus, this vaccine with Sinopharm, and now we started to vaccine also the frontline, which we are. This is my photo that I'm taking the vaccine, and also the implementation of the AI, the artificial intelligence. This small vehicle is being monitored through the distance by the computer system, and used to go and reach each single house or a villa to provide the medications, the PPEs, the sanitizers to the people, and to help them and provide them with the quality of care and with medications, and not to allow anyone to suffer. The usage of the drones for the disinfection programs, and the mobile applications for the communication between the people, the people with their physicians, and also the telemedicine, which we were able to cover the entire United Arab Emirates with the proper counseling, treatment, medications, and also the support to them by some of the new innovative ideas. And I will conclude my presentation in showing this slide as a statement from His Highness Sheikh Mohammed bin Rashid Al Maktoum, that innovation is what defines our status among nations and the value we add to the world around us, which it means that even during the pandemic situation, we were able, by implementation of the most innovative ideas, new innovations, new technologies, Internet of Things, and AI, to serve our community and to provide them with the highest quality of care. And this, for sure, it supports the longevity, and it supports the healthy lifestyle to be properly implemented with our community in United Arab Emirates. Thank you very much, and it was my honor and pleasure to join this conference with you.
It was our honor and privilege to have you involved, and thank you so much for an excellent presentation and the focus on prevention, the role of innovation, and how you've tackled so much. It's quite incredible. So we're going to move on now, and for all of our panelists, on the in this particular session on countries, if you can stay to the end, we may have some time for questions, because unfortunately Sofia Takanola from World Economic Forum can't join us because she's ill today. So if we have time, and if anyone can stay to answer some questions, that would be fantastic. But a fantastic presentation. Thank you so much. And I didn't realize that about the vaccine the trial already taking place. So really, really interesting. So I'm going to stop and hand over to Dr. Alex Mihailidis, who is the Associate Vice President of International Partnerships and Professor at the University of Toronto, Scientific Director at AgeWell, which is a network of centers of excellence in Canada, who I had the pleasure of speaking with a couple of months ago, and who's going to take us through what is the situation in Canada, my home country. So over to you, Alex, and so pleased you're here.
Great, thank you very much, Tina, and thank you, everyone. I hope you can all see my slides, okay?
You can.
So good morning, good afternoon, good evening, depending where you are. These international conferences are always fascinating experiments to do online, as you have people across various time zones, etc. But it's always a pleasure to still be part of this. So thanks very much for inviting me to present today on the perspectives from Canada. And to set a little context, I'm going to do something a little bit different, I think, from what you've heard thus far, and really focus in on one specific context of what's happening within Canada. Our Canadian government at the federal level and the provincial level has really been trying hard to look at new ways to support our older adults, our caregivers, our care staff, our healthcare workers, etc., through new and innovative approaches. And one of those aspects is actually through the role of technology to support our aging population previous to the pandemic, but even more importantly, now with the pandemic moving forward. And so that is the perspective I'm going to take. And what I'm going to actually talk about first is AgeWell, which is our national network on technology in aging, and specifically developing new technologies to support our older people. And the way we're doing this is by what you see on the slide here, and that is through the development of a community of researchers, older adults, caregivers, partners, and future leaders in order to accelerate the delivery of technology-based solutions that can really have a meaningful difference we say in the lives of Canadians in general, because obviously we're all aging. I heard from a very smart person one time who said, if you're not aging, you're dead. And I think that's an important thing for us to remember as we move forward in this conference and others, that we're always aging at all times. And so while we're talking about a specific demographic of aging people, very quickly that demographic changes and their needs change as well. In terms of AgeWell, in terms of size and scope, as you can see here, we are quite large. If you add up the number of researchers and trainees and students that are involved, we have over 1,000 individuals that are involved at all levels. This is across 43 different universities. And more importantly is that we have over 110 international collaborations across 28 countries. And so Canada has really been trying to position themselves as a world leader with respect to technologies for older people, and especially now during COVID and moving forward. And in fact has been trying to develop the age tech sector, again, just not in Canada, but around the world as well. So for example, we've been working very closely with our federal and provincial and territorial governments about how technology can play a role in key new strategies, such as our aging strategy and our new national dementia strategy as well. We heard previously from a presenter from the United States who said, they really don't have a longevity strategy, but an aging strategy. Well, Canada is even further behind than that we are now just developing national aging strategies and dementia strategies. And the challenge that we have in Canada, which is similar to probably other countries, is people think that Canada has one healthcare system, and that's not true, because healthcare is managed by the provinces and the territory. So we actually have 10 different healthcare systems within Canada. So as you can imagine, trying to get them to do anything together is a great challenge. So within the network itself, we're not just about developing technologies, but we also believe that the development of technologies must go hand in hand with the development of policies and practices and service delivery models. One thing we always say is we can build the best robot possible to support older people, but if you don't understand the regulatory aspects within your country that allows that robot to be used in a healthcare situation, and you don't understand how that robot's going to be delivered to the older person themselves, whether in their home or in long-term care, which is becoming more important these days, then that robot's just going to sit in the research lab. And we see many examples of that moving forward. So you see some examples of things that we're doing right now within the network across the country and with international partners. And many of these solutions are actually now being seen as applicable in the support of older people and their caregivers during COVID, and perhaps more importantly in a post-COVID world as well, because as we know, we're starting to see a lot of remaining impacts on individuals who have suffered from COVID. And so the question is, how do we support them as well as we move forward? So specifically in terms of Canada responding to the COVID-19 pandemic from a technological perspective, when COVID-19 was announced by the WHO as a pandemic, our network and our government took action by outlining how age tech can lessen the burden of the COVID-19 experience of older adults and caregivers. And we did this really through three things. First, we started to really identify and promote existing and developing solutions, including those that are being developed by our industrial and corporate partners, such as Philips Healthcare, IBM, and other large organizations that are in the tech industry, but perhaps not older adults. And we try to identify those that right away can be applied in the COVID-19 context. So we wanted to have solutions that were not going to be ready in 2-3 years down the road, but things that are ready right now that we can implement in order to support older people, particularly in long-term care, as I'll talk about. Second, we developed funding partnerships to support COVID-19 related research to respond to the crisis and the recovery efforts. And so that was really critical, is that we needed to very quickly build up funding resources across all of our funding agencies and organizations to really focus on COVID-19. And that was right from trying to understand things such as therapeutics or obviously vaccinations, to the more applied side that AgeWell is taking the leadership on around the role of technology. And finally, we proposed new programming that allowed us to inform policy to transform care in the home, community, long-term care settings. And I'll talk a little bit more about this as I move forward. So to talk specifically about some statistics related to technology, older people, and COVID-19, we actually conducted some polls that I'll present right now, which I suspect may be similar to other countries around the world as well. So first and foremost, obviously Canada is aging, and in fact, it's not very well known, but when you talk about the projected numbers of older people in our countries globally, Canada actually is one of those countries that will be considered super aged, along with Japan and other Asian countries around the world. So we're right up there in terms of our aging population, the issues that we need to deal with. Furthermore, not only are we seeing an increasing number of older people within Canada, but because of the quality of our healthcare system, we're seeing more older adults living longer with various chronic diseases. And in fact, that is why one of the reasons that they are looking at in terms of why Canadian seniors have been impacted so greatly by COVID. And that's because, again, they're living longer with chronic diseases, and therefore they're far more susceptible to COVID because of their secondary or tertiary conditions that they may have. So in terms of the stats that we did, as in the case of many other countries, our older Canadians were the hardest hit by COVID-19. So in fact, Canadians 60 years and older represent about a quarter of all cases, which is about 243,000 right now in our country. However, this same age group also represents 97% of all COVID deaths. of which we just have over 10,000 currently right now. So as you can imagine, this is a really critical issue for our government and for our healthcare system in terms of looking at the older adult population. Many of these deaths have occurred in long-term care homes that were understaffed, not designed for physical distancing, nor prepared with enough personal protective equipment for this pandemic. And again, this is similar to other countries around the world. Now, as you see here, an age-well poll that was conducted by Environics Research showed that 66% of Canadians over the age of 50 have felt isolated at least some point during the pandemic, which is a big issue. Our partner organizations also report an increase in loneliness as well as elder abuse during this difficult time. So again, additional confounding issues that we need to deal with. It is not surprising then that older Canadians are less optimistic about aging in 2020 than they were about last year at the same time. And this is an increase of about 8% in these perspectives. Now, the poll also showed the resiliency of older adults in Canada and how COVID-19 has significantly increased their use of many different types of technologies. About a quarter of the older adults we polled are now using video calling on their smartphones, and they didn't do this before the pandemic. In fact, this is twice as many older Canadians that we found when we polled in 2019. And 60% of them are actually saying that this increase in their use of smartphones and video conferencing is because directly related to COVID-19. More older Canadians are also using social media, online shopping for essential items, and online streaming as well. Overall, about 2/3 of Canadians aged 50 years and older believe technology advances can help to lessen the impact of COVID-19 on daily life. And finally, 76% of Canadians aged 50 and up are confident using technology, whereas 2/3 are willing to pay out of pocket for the technology that allow them to stay in their own homes and to age safely and independently as possible. Now, in terms of some final reflections around the legacy of COVID-19 and healthy longevity, I have 3 reflections to share with you and to leave you with. First is that we are seeing incredible speed in the way new policies are being created to respond to this crisis. And we've heard this from some of our other presenters as well. For example, telehealth payment codes were quickly created early in the pandemic in Canada so that physicians could see their patients virtually and be able to enter virtual visits into billing systems. You know, it's amazing here in the province I live in Ontario, you know, for years and years and years, we tried to do this and we couldn't get it to happen. But all of a sudden, literally over a weekend, the system got implemented amazingly. The research community has to be ready with evidence to help inform these policy changes by looking across Canada, but also internationally at how decisions are being made and implemented, making events like today's summit crucial for this type of exchange. In other ways, the policy and system changes simply cannot arrive fast enough as we grapple with the second wave of cases in Canada and soon a third wave, and long-term care homes are once again being faced with significant outbreaks. Additional beds are being funded in some areas, but a stronger focus needs to be placed upstream on healthy aging practices and supports for aging in place for older Canadians who prefer to age in their own homes and communities. Second, the digital determinants of healthy longevity are human rights. This means providing equitable internet access, digital literacy and fluence, as well as infrastructure. Our government now is starting to invest more in broadband internet, and on Monday, actually of this past week, our government launched a $1.75 billion universal broadband fund that promises to connect 98% of Canadians to high-speed internet by 2026 and to have full coverage by 2030. This is a good starting point, but older adults will still need access to a computer, a tablet, or smartphone in order to get online, as well as a training for how to use these devices and applications. Finally, as you saw from AgeWell's polling data, from social media to video calling and fitness trackers, older Canadians have ramped up their use of many technologies and online services during the COVID-19 pandemic. With these findings, we cannot set aside any notion that older adults are technophobic. This is an old attitude that needs to be removed. They are unfazed by technology and are looking for these products to improve their daily lives and help them age well. COVID-19 is clearly a catalyst that is taking tech use to a new level for Canadian seniors. This is why, as Canada's Technology and Aging Network, AgeWell will continue to co-create solutions alongside seniors and their caregivers in order to make sure that we're getting products onto the marketplace as quickly as possible. At this point, I'd like to thank you again for having me here. Here's some information if you want to get in contact with us and also to join the efforts of AgeWell and our network partnership. And again, I look forward to any questions or comments that we may have and to working with all of you around the world. Thank you.
Excellent. Thank you so much, Alex. That was wonderful and interesting. Quite a lot of parallels with the UK scenario, which I know Geoff Filkin will be coming on to. And a message for everyone, we will try and make sure that there'll be access to all these slides after the event. And we will try and get some questions tabled right at the end. We're a little bit running late, but we'll hopefully have some time at the end. So I'm going to hand over to Joanna Bensz, who has done incredible things in Europe with her practical focus on how to make healthy longevity reach the consumer. So I'm going to hand over to Joanna, who will take us through what is taking place on the European stage.
Thank you very much, Tina. And this is quite a challenging requirement to actually cover the whole of Europe. But what I would like to show today is what a number of practical applications that we are trying to implement across Europe. So I'm wearing two hats. Again, my name is Joanna Bensz, and I'm representing both the International Institute of Longevity and also a longevity center, which I'm going to speak a little bit more about later in the presentation. Okay. So International Institute of Longevity is it's an organization bringing together experts and various industry leaders and stakeholders to implement practical applications of longevity into industry and into practice. So we cover we are focusing on age science, on preventive health, but also on longevity economy. One of our main activities is something we call Vaduz Roundtable. We are located both in Poland and in Liechtenstein. This is why Vaduz Roundtable, which where we are bringing together experts from both science, again, economy, decision makers, European Commission, and other influencers, insurance, trying to discuss and prepare actionable recommendations and solutions in terms of what is happening in Europe and what are the recommendations for growing the sector and the research on longevity across Europe. One of our recent white papers is still available on our website, so you can download it and read a bit more about the recommendations. Recently, we also had a roundtable on biomarkers of aging because, as we already heard from a number of speakers, biomarkers, especially of biological age, are some of the newest ways to measure prevention. And recently, actually on Monday, as part of the Longevity Week, we have hosted about 15 experts from insurance sector from all around the world and talked about how to find new ways of financing prevention, because on one side, preventive solutions and longevity solutions could be financed and possibly will be financed from governmental by governments, but in the meantime, there is a huge opportunity and possibility for the insurance sector to get involved. Some of our outcomes of the first roundtable, summarized in our white paper, was showing us that there is a big discrepancy in terms of definition of longevity, because some of us are understanding longevity as only the 65 plus and the longevity dividend, but also, there is a huge growing opportunity in terms of age science and longevity solutions that are helping us to age differently. And currently, 95% of public funds are going mainly into methods and devices that help older adults to cope with challenges of the aging process. And only 5% is devoted to biological mechanism of aging. And also less than that is devoted to delaying aging. One of the important recommendations, findings from the last roundtable was that the mortality only cost of providing life insurance to a person leading an unhealthy lifestyle can be 10 to 15 times more of a person leading a healthy lifestyle. Therefore, there's no-brainer that we should focus more on the preventive side of on prevention. Also, one of the papers published by, sorry, I just froze, by Back Institute was emphasizing that only 10% of genetic contributes to longevity, where 90% is actually in our hands, and we can influence it by our lifestyle choices. Max Planck Institute published a paper saying that a healthy lifestyle increased life expectancy by up to 7 years. Therefore, we were looking at more practical solutions to be implemented in the longevity field, especially that we didn't see too many doctors being involved in this field. And we have created the first longevity center in Central Eastern Europe, which is based in Warsaw. And we are currently preparing a few more across German-speaking areas. And we are focusing mainly on preventive, proactive, and personalized lifestyle medicine and medical solutions that are already possible to be implemented into practice. So we focus on health management rather than disease management, and early detection and modern prevention. Our doctors, we actually bring together doctors, psychologists, psychiatrists, and also sleep experts to look at our clients in a more holistic way. And we hope that this is going to be also setting possible opportunities for other companies in the medical sector, looking at medicine and trying to implement the solutions in a bit more holistic way. So our multidisciplinary team is implementing personalized and science-based methods focusing on healthy longevity. We are currently designing our own longevity protocol, which is going to help us to place it also in our clinics that we are planning across Europe. So we are focusing on aspects like sleep, stress, exercise, mindset, genetics, but also epigenetics. One of the newest solutions we bring to the medical field, and this is still a very early stage in, well, we see that we are one of the very few centers in Europe doing that. We decided that to measure prevention and to measure effects of prevention in our treatments, we need to introduce a number of ways to measure biological age. And as it was mentioned earlier, also in terms of COVID, we see also this in our center, that our clients that have higher biological age than their chronological age are usually more affected by COVID than clients that have that are actually looking that are more taking care of their lifestyle. And so our client journey starts with a lifestyle interview we do a full epigenetic checkup and then recommend a longevity plan. We are using different biomarkers of aging, and hopefully there's going to be more and more of those biomarkers becoming a status of medical products rather than lifestyle products. But at the moment, we can use them as let's say, empowerment solutions to help us to measure progress. We also use we are also using various wearable devices that are helping our clients to follow recommendations and to measure progress at home. And we are focusing mainly on the business sector and also working with insurance companies. And our passion is to guide our clients through each step leading to personalize health goals. Thank you very much, Tina.
Excellent. Thank you so much, Joanna. Really insightful, and it gives us an appreciation of what is actually out there at the moment to deliver these sorts of approaches to the end consumer. And of course, the role of the insurance sector is a very, very interesting one. So I'm going to now ask Lord Filkin, Geoff Filkin, to give us our last presentation. And of course, Lord Filkin has been hugely instrumental and has been the driving force behind the Health and Nation work of the All-Party Parliamentary Group for Longevity. So I'm going to hand over to Geoff. I'll ask him to start his video so he can start his presentation. Just there we go. So Geoff, over to you.
Hello, Tina, and good to be in the conversation with lots of colleagues from around the world and to hear how there are some very clear common themes and issues. What I'd like to do is just to give some reflections on where we are in the UK, both in health generally and on what the COVID crisis has brought, in a sense, highlighted the need for change. We start from a position where we are not in a good place. We've got one of the highest levels of one of the poorest levels of poor health in Europe. And we have had one of the highest death rates from COVID. So there's no grounds at all for complacency. I'm going to ignore the postman at the door at present. Secondly, it shows, therefore, we need to do much more to improve the health of our nation as a consequence. We can't be complacent in many ways that we are a healthy nation. And I suspect that's true of other nations as well. The crisis has shown up that we need to do much more to improve our fundamental health. But we also should see this as an opportunity. We're aware in England, in the UK, and it's true of many countries, that we are living much longer, and this is a phenomenal asset. It's the opportunity to work longer, to give more, to enjoy more, to have a much more beneficial life. On the other hand, we are also aware, as has been pointed out by others, that we are not living as long healthily as we are increasing our overall age. So many of us, most of us, are living for longer in ill health. And that's the central policy challenge, I think, for health and longevity. How to make it possible for many more people to live longer, much longer in their lives with health, with good health, because that makes it much more possible for them to be happy, to enjoy their well-being, to keep in work, etc. If then we use COVID as a wake-up call, what does it show? It showed if you look at who died, and I'm speaking generally using some national data and some international data, but who died, obviously, we know that it's the old who are much more likely to have died as a consequence of COVID. And we won't go into what some of the early reasons are from that, but you know that well. But secondly, if you look beneath the skin of that, it's those who already had poor health before they were infected that were more likely to die. Those who had high risk factors, such as obesity, were more likely to die. And those who were poor people and lived in poor places were also more likely to die. The evidence about Black and ethnic minorities is complex, but Bangladeshis in England were vastly more likely to die than white British, but that was probably mainly because they were poor and lived in poor places. So no grounds at all for feeling that we can carry on as we are in this situation. And the response, of course, isn't just to build more hospitals. The response has to be, we think, to take a very strong look at how we improve our healthy life expectancy. At one level, we were very pleased in the UK, many of us who are fascinated and committed to this subject, when the government reaffirmed its commitment to improve healthy life expectancy in the UK by 5 years by 2035. That's a great goal, to say that we're going to spend 15 years making it that on average people live 5 years longer in good health than they had done so. That is very, very necessary, because in fact people get ill with their first serious long-term condition much earlier than we thought. On average for women, it's at the age of 55, not 65 in England. And the poor live with ill health for 20 years longer than the rich do in Britain. You'll find similar data, I think, in many other countries as well. So there's both an enormous social waste and there's an enormous social gradient going on about premature ill health. So we were delighted when the government made this commitment. We were not quite so delighted when we waited a while and we saw no real sign of an action plan and a strategy and an engagement with society as to how they were going to do this. So rather than sitting back and waiting, a number of us, Tina and I particularly, with Damien Green and the Old Party Parliamentary Group, pulled together some of the most eminent expert organizations in the country, eminent health organizations, aging organizations, behavioral insights team. And we worked over an intensive 9-month period to develop a strategy which set out what we thought were the ingredients for achieving this goal of improving healthy life expectancy by 5 years by 2035. I'll speak briefly and in short, but if you want more detail, I'm sure Tina can send you the link to that strategy. What did it say? Well, first of all, recognize it's possible to make change. And this, I think, is fundamental for all of us. Otherwise, some of these goals just seem pie in the sky or aspirational. The evidence of why it's possible is before us. Look at the improvement we have made in many countries on reducing smoking over the last 20 or 30 years. Quite remarkable reductions in the number of people who smoke. Similar, quite remarkable reductions in the number of people who have cardiovascular diseases. Further illustrations, if you look in many developed countries, we already have evidence that it is possible to live for much longer in good health. The rich people in our society, by and large, show that's possible, both because they've been well off, they've had good diets, and they've had healthy lifestyles. So there's clear evidence that it's possible as a goal. Next, therefore, the first action after recognizing that it's conceptually possible is to get a much stronger societal focus on prevention of ill health. There's a debate in Britain about whether we need more hospitals or not. Someone thinks we do, maybe we do. But more hospitals will not shrink, will not improve healthy lifestyle, healthy lifespan. You've got to do something about the prevention of ill health, its early detection. And so that issue of how to be effective at early prevention and detection. One of the most powerful pieces of evidence we got was given to us by the Chief Medical Officer, and he was quoting the World Health Organization. If we focused on the 4 behaviors of smoking, unhealthy diets, excess alcohol, and inactivity, and drove resolutely to prevent those, we will reduce 75% of the new cases of heart disease, stroke, and type 2 diabetes, and 40% of cancers. There's a further data point. If we eliminated smoking in Britain totally, we would have closed the social gradient the health gap between the richest and the poorest by 50%. So actions to reduce these negative behaviours, whilst it's not sufficient, it must be a central part of any strategy in the UK, we think, to improve our healthy life expectancy. But environments matter too. And you've seen, most of you will be aware of the pioneering work by Michael Marmot about showing how powerful environments, physical environments, social environments have on economic environments have on our health. Even these fast change can sometimes be made. If you look at how the nitrous dioxide levels in central London have reduced in 5 years just by a few powerful regulatory changes by the London Mayor, it is quite striking. Relatively simple measures to push off the roads those vehicles that create the most nitrous dioxide. So there's significant changes needing to our environments as well, and maybe the push for climate change can be used as a part of it. Next, we need to recognize that if one's thinking specifically about behavioral change, we need to do what works. And there is enormously strong evidence of what works to shift behaviors. The problem has not been that we don't know enough about that. The problem has been getting governments to act on it. Look at the paper by David Halpern in our strategy book. And it basically signals there are a range of nudges, price incentives, and support mechanisms, plus the moderate use of regulation, can make a really big difference to shifting behaviors, particularly if we're looking over a 10-year period. So a willingness to use the evidence of what works and a willingness then to apply it without inhibition is what governments and policymakers need to do. And for too long, policymakers have been timid about this. They have been, I think, infected by uber-libertarianism, not wishing to use both regulations or positive stimuli. But, one obvious example, if we want people to eat healthy lifestyles and healthy foodstuffs, we've got to make the healthy choice, the easy choice, and the cheapest choice. And so we need to use both taxation and regulation and business behaviors to shift our food environments. It's possible to do so. It's just we've not been willing to do so far. It's not just a goal for government, though. It's a goal for all of society. And let me just quickly rattle off 4 or 5 areas where we need to see action towards this goal to improve our societal health. First of all, the NHS, our health system itself, needs to recognise that it's got great leverage and potential to do more, prevent ill health, to detect ill health earlier, and to be better at intervening to do so. It already does quite a lot of good work. It needs to do vastly more. It only spends 5% of its budget on prevention. We argued progressively that should increase to 15%. And there's a great deal that it obviously can do without going into detail now. Next, business itself needs to become part of the solution. At present, we all know that some businesses, the alcohol, some aspects of the food industry, the smoking industry, do quite a lot to worsen the health of our society. If they were being introduced into our societies now, they would never be allowed to be introduced because they would be seen as so harmful. But we've got to do more to recognise that businesses want to shift to being seen as the salvation rather than the cause of ill health in our society. And we hope that we can build, through a new coalition we're about to launch, mechanisms for doing so that businesses commit to improving the health contribution that they make from their own business and from their own sectors. Localities and communities, this is not just a top-down agenda. Localities, local governments needs to have conversations with its populations about what's their health conditions, why that matters, what can be done to do it, and how they're going to commit locally to training there. Science and technology, we've already touched on, raised by previous speakers, biomarkers, wearables, behavioral triggers. We need to maximize and optimize these without pretending that all the solutions will come from science or technology. But perhaps in conclusion, it's politics above all that needs to own this agenda as well. To recognize it's possible, to think that goals that are 15-year ones are still ones that governments should commit themselves to, because we've seen evidence in the past when they do so, they make an enormous difference. We want them to set the goal, to will the results, to support the process, to use the evidence of what works, and to mobilize and motivate all the actors to commit behind this, which is why when we can get more attention from our ministers, who are rather busy with other things at present, we're committed to trying to ensure that they recommit to this agenda and do something better and to build back better. So I think there's great opportunities for all our societies to improve the health of a nation and to use the imperative of COVID to show why it's necessary and how it's possible. Thank you all. Look forward to the discussion.
Thank you so much, Geoff. That was magnificent and a fantastic overview of where we've reached with all the work taking place over the last year and a bit.